So
why is weed bad? Well, weed is especially bad now because it is supercharged. What happened with Colorado legalizing it and the 24 some states that have legalized recreational, they created an industry. That industry has totally altered marijuana as we know it. They have genetically modified it. It is now completely chemically created. You have flower, that's the plant, that is getting up to, being taken from the plant, that is getting up to about 40% potency THC. That's the ingredient that gets you high. The plant in a state of nature was like 1, 2, 3% THC. So this is not natural. And also, if you're like 30 something, it's not the marijuana that you grew up with in your teens either. I mean, it is radically changed. And now we're getting concentrates that are up to 99% potent. Wow. So it is a totally different drug. It used to be 1 to 3% potent a few decades ago. So that has led to a few big changes. First biggest change is it's much more addictive, much more addictive. 30% of people who use marijuana in the last year will develop a cannabis use disorder. That is the term for marijuana addiction.
Howdy, everyone, and welcome back to Moment of Truth, the podcast of American Moment. My name is Nick Solheim, and I'm the CEO of American Moment, and I'm very glad to have you back with us for another great episode. We have not had our friend Luke Niforatos from Smart Approaches to Marijuana, or Sham, as it's called, on the podcast in quite some time, and so we thought it'd be good, as we've been kind of going through this Maha series. We've had a lot of Maha podcasts recently, to do another episode on why pot bad and why rescheduling it would be bad. So we were joined by our friend Luke, who has been giving lectures to American Moment programming for a number of years. He is our go-to guy on drug policy. We are huge fans of his work and his organization's work. So I was really excited to do this episode. He's a great guy. And if you're in the administration and there's some sort of interesting, policy you would like to do about this stuff, this is going to be your introduction to Luke. So let us know, and we can definitely put you in touch with him. So we will go now to great guy, friend of American Moment, and the leader of Smart Approaches to Marijuana, Luke Niforatos. Luke, thanks so much for coming back on the podcast.
Thanks for having me. It feels like it was just yesterday, but I guess it's been a few years. So we were due here.
It has been a few years, which means that we need to do another refresh about why pot bad. And so to give everyone that listens to this show, and I think we have a lot more listeners now than we did when you first came on, tell us a little bit about your background and the organization that you run, Smart Approaches to Marijuana.
Yeah, or SAM is our acronym. Absolutely. So a little bit about myself. My background is I come from Colorado, first state to legalize marijuana. And I was very much opposed to that and saw that play out. So that obviously inspired me to get onto this journey, and we can talk more about that. But my background's in healthcare, actually. So I started out working in nonprofit community healthcare out in the eastern plains of Colorado, really helping ranchers and farmers and folks who didn't have access to quality care get care. From there, I actually started a company in the digital health space and sold that company. And so that was kind of my background, was really entrepreneurship, startup world. And from my perspective, I always wanted to solve problems. I enjoy solving problems, and I enjoy solving problems that help people. And I needed to look no further than what was happening in my own state to see there was a problem that needed to be solved, which was that we had legalized marijuana. It was a total failure every which way you look at that policy. And it's gotten even worse since I started about 8 years ago fighting on this mission. And, I was married. I had one little girl then. I now have 2 little girls. But I saw the impact when she would go to playgrounds, and there was secondhand marijuana smoke at playgrounds, people lighting up joints around kids in my state. And, you look at that and you say, you don't want this for the future of America. So that was kind of what drew me to the issue. And that's really my background. And so since then, I had an undergraduate degree in communications, master's at Johns Hopkins in public management. And I'm actually doing my law degree right now part-time. So that's kind of what I'm doing right now.
Did you start this organization, by the way? I don't actually know that.
So I joined up. We had 1 employee when I joined. So I was kind of into the ground floor. And at the time, we were finding a lot of support because Colorado and Washington had legalized. There was a lot of people that were kind of scared about it coming to their state. They wanted help. So our organization was rising. And I ended up meeting our co-founder, Dr. Kevin Sabat, who was a former 3-time White House official. Really the leading drug policy expert in the country, in the world, really. And he was fighting this good fight against it. And he said, hey, why don't you join up? You're from Colorado. You see this. And so then next thing I know, he and I are managing an organization that's international. We have a lot more staff and a lot more impact now.
Yeah. So you hate marijuana that much.
I will tell you
that you have endeavored upon this new section of your career specifically dedicated to making sure that this legalization doesn't spread. What about it radicalized you that much?
Yeah, I think what radicalized it was, I voted against it when I was a single bachelor in Colorado, but I kind of didn't have strong opinions about it. I just knew, I morally was opposed to it, didn't like it. But I saw it grow in its impact. I saw that I couldn't go throughout life without being impacted by the policy in some way. And it really bothered me. The smell. Then I got married and there were people acting weird on the streets when we'd be downtown for dates. Then I had my first daughter and we're taking her for walks and people are smoking around her and it's impacting her lungs and everything else. And I just realized this is something that's not going to go away. I can't ignore it. And from my perspective, you look at it from a startup perspective, when you're starting a startup, one of the first things you do is you look at the total addressable market and you say, who are the other competitors in the space that are tackling the problem that I want to solve with my product? And excuse me. And what I looked at was, you look at the space of drug policy, look at the space of fighting against marijuana. There was nobody else that was doing it. I met this guy, Kevin Sabet, and he had this organization. They had one employee, but this was at the ground floor of this whole movement. And I had no idea that this would basically be the rise of the new anti-drug movement, my generation's anti-drug movement, which I think is rising now to a crest, thanks to folks like you and others who they philosophically understand more drugs in society are a problem. But back 8 years ago, there's really nobody doing it. And so I thought, nobody's solving this problem, wide open market need. This is something that's going to help people. And so, I got radicalized big time. I decided to tackle it.
So how did legalization come to pass in Colorado in the first place? Like, what was the movement that led to it? Was a referendum, right? So what was the movement that led to the referendum, and then how big was support for it actually on election day?
Yeah, so it's a great question. So historically, Colorado, we voted twice on the ballot. The first time we defeated it, it didn't pass. The second time was the charm in 2012, and it passed narrowly. I think it was about 54% or so yes on that ballot measure. And really what led to it was millions of dollars were contributed from the industry. There was now a medical marijuana industry that was at play in Colorado and a few other states. They had gotten a lot of money. Then you had a lot of Soros-backed groups, this New Approach PAC, which then was kind of in its nascent stages. Now it's a major pro-drug player. We can get more into that later. But New Approach PAC got involved. A lot of billionaires got involved. So they raised $10, $20 million to pass this. So it was a big money play. There's a lot of industry. But they also, what they did was, and this was probably the best performing ad of that referendum, was they said, this is just more medicine. We already have medical marijuana, but we need recreational marijuana in Colorado because we need more medicine out there for our veterans, was essentially what they were saying. And they're saying it was going to, help and cure veterans' PTSD. Well, that has not happened. PTSD continues to be a problem. And not only that, now the research tells us that actually is totally a farce. It doesn't actually help their PTSD. But that was kind of what this measure was sold on. And that's how it got over the finish line.
Who are the biggest institutional backers of legalized marijuana? I mean, one would think that conventionally it would be the left. But I know that there are also a lot of people on the right that support this. How does the well-connected people behind the scenes, how do they play into all this?
Yeah, it's a great question. I mean, basically, anywhere there's a ton of money, you got people who want to cash in, right? Yeah. So it started with George Soros, and
of course,
as things always do, he gave $200 million to the Drug Policy Alliance. That was basically their start to try to legalize all drugs, which is the mission they're still working on doing. And then John Sperling from the University of Phoenix, several other billionaires got involved. Then you had the Koch brothers recently get involved. They want to legalize all drugs too. And so you have some kind of an interesting alliance between some very far left, few kind of extreme libertarians. And then you have the folks that just want to make money, like John Boehner, for example, is somebody who works for the Cannabis Roundtable.
I was going to say, I thought I had seen something.
Yeah. So you have John Boehner. Then you have some other folks that, clearly they're in this because they're going to get a check.
Yeah.
And I think
you can't imagine John Boehner like lighting up a joint or anything.
He even says he won't do it. And in fact, this is a guy who said, I'm inalterably opposed to marijuana legalization. That was what he said while he was in office. And now he's kind of changed his tune. But my understanding is it's really about the business for him. And I don't think he partakes at all.
That is wild. That is just, it's so naked,
That's the funny thing is a lot of people are saying the quiet part out loud when it comes to marijuana stuff. Like they're not even hiding the ball that it's about the money. And whether or not we care about if people are addicted, if people are getting hurt by this, if there's people going psychotic in droves because of this policy, it's not about that. It's about the money for folks.
Yeah, it's sort of like a, for thee, but not for me type situation.
Which, by the way, historically, you look at tobacco, and the tobacco executives said, we are reserving these products. You looked at the master settlement. They got all these documents out of these guys in the master settlement, and they said, this is for the poor, the stupid, and the black. That's what they were saying. The executives were saying behind closed doors. And so there is an addiction for profit mentality with the marijuana movement, where it is the elites that are cashing in, while those who are poorer and less fortunate and more marginalized are the ones that end up footing the bill for a lot.
You're not going to convince me about tobacco, but I digress. So let's do the overarching. Why is weed bad?
Why is weed bad? Well, weed is especially bad now because it is supercharged. What happened with Colorado legalizing it and the 24 some states that have legalized recreational, they created an industry. That industry has totally altered marijuana as we know it. They have genetically modified it. It is now completely chemically created. You have flower, that's the plant, that is getting up to, being taken from the plant, that is getting up to about 40% potency THC. That's the ingredient that gets you high. The plant in a state of nature was like 1, 2, 3% THC. So this is not natural. Then
this isn't your parents' marijuana.
Yeah, not your parents' marijuana. Yeah, and also if you're like 30-something, it's not the marijuana that you grew up with in your teens either. I mean, it is radically changed. And now we're getting concentrates that are up to 99% potent. Wow. So it is a totally different drug. It used to be 1 to 3% potent a few decades ago. So that has led to a few big changes. First biggest change is it's much more addictive, much more addictive. 30% of people who use marijuana in the last year will develop a cannabis use disorder. That is the term for marijuana addiction.
Yeah. So I thought we were told that couldn't happen.
Yeah. We were told marijuana is not addictive. They said marijuana is not addictive.
That's what I was taught in school. It is not a gateway drug, actually.
Yeah. Oh, yeah. That's the other myth. Not a gateway drug. Well, we know that if you use marijuana, there's a recent study that finds you're 38 times more likely to use illicit opioids if you're a regular user of marijuana. So absolutely, it is a gateway to other substances for folks. You don't just start out your life using meth or cocaine. Like you don't start there. Usually you're starting with marijuana. 97% of heroin addicts started with marijuana. Wow. So we can't deny that it is priming your brain that way. So that's the first big change, the addiction, right? Second big change is the mental health impact. So this drug now, with it being so highly potent, with it being so addictive, it's actually starting now, we're seeing research show that it has a causal link to psychosis, schizophrenia, and other kinds of anxiety disorders and other mental illnesses. This is something that, people think, reefer madness, this is craziness. Well, this drug is not the same anymore. It is, if you have an old school view of marijuana, you need to get a new school view. This is something that is so potent, it's causing a lot of damage to people's brains. And unlike alcohol, where, yes, alcohol has its various health effects, alcohol doesn't make you go psychotic. It doesn't make you start hallucinating, seeing things that aren't there, and having permanent schizophrenia, which is, by the way, if you're regularly using marijuana in your youth, you can actually you're 5 times more likely to have a permanent case of schizophrenia for the rest of your life. That is very concerning stuff. So as we think about this being much more available to the public, more youth are experimenting and trying it. These are things that public health professionals and folks like us are very worried about.
How much of the mental health epidemic, because you meet these people all the time, who are like, bipolar, I have schizophrenia, or multiple personality disorder, or whatever. Do you think, and I understand maybe there aren't studies about this, but is attributable to the use of marijuana?
I think it's a great question. I don't know the full answer, but I will say the National Institutes of Health did a giant research study a couple of years ago. What they determined was 30% of all of the cases of cannabis induced, 30% of all the cases of psychosis among young men in this country, 21 to 30% of them could be avoided if they weren't addicted to pot. Wow. So that is a gigantic impact, we know, just in psychosis cases nationwide among young men. Yeah. And I think that is striking. I think particularly there is a movement to try to addict young men in this country. You look at sports betting, you look at marijuana, you look at porn. All these industries are targeting young men's minds, trying to get their eyes off the ball of productivity, being fathers, being responsible in our society. And I think that the marijuana piece of this is a substantial one, and it's one that no one's talking about.
Well, it is kind of crazy. Like I'm a big baseball fan, so I watch a lot of baseball on the MLB app, and all of the ads are either it's either something sports betting related. That's like half of them.
Yep.
And then there are a lot of the it's like the GLP-1s and stuff like Ozempic and that sort of thing. And then drugs. I don't think I've seen that many specifically about pot, but like a lot of ads about, this drug will make you not psychotic, basically.
Right.
Like you're losing your mind.
Schizophrenia treatment.
And it's actually like really depressing to think about, like, wow, all the other guys that want to watch baseball, this is like what they're being inundated
for
with,
a reason. Yeah.
So what is say you're, sophomore in high school, you're 16, you have pot for the first time. What is going to be kind of the life cycle here in a negative case?
Yeah. So in terms of what are the implications for young folks using it? Yeah. I mean, there's a lot. I mean, I would say, the mental health impact, you're much more likely, like I talked about, psychosis, schizophrenia, especially if you're using it regularly. If you're using it like every day or every week or something like that. The other impact beyond mental illness for folks is their IQ. So your IQ, if you start in, you gave the example 16, you start at 16, you use up through your young adult years, you're looking at a permanent loss of IQ points from 3 to 5 points. That's going from an A to a C minus in terms of a student. And you're not getting those IQ points back. Yeah. And a lot of people maybe will laugh, roll their eyes, whatever.
It makes you dumber.
This is, funny. It makes you dumber. And obviously like societally, I think folks know that, but I think people like will hear a statistic like that and say, no way. It's like, this is a giant study that was actually cited in the National Academies of Science, right? These are some of the foremost researchers. This is rock solid science. And we've known it for a long time. Then you look at the dropout rates. You look at the absenteeism rates in high school. You look at the grade performance rates, all of that substantially, significantly lower for young people who are using marijuana. Yeah. And I think, the pushback I get is, well, yeah, Luke, like we're legalizing it for 21 up. So that doesn't matter. Like it's not for youth to get their hands on. And my response back is, look at our other two legal drugs, alcohol and tobacco, very accessible in schools. I mean, I went to public high school. I could get my hands on alcohol or tobacco anytime I wanted. So we are actually talking about normalizing something for our kids, whether we like it or not. And I think it's important people understand that with policies, and you can write them however you want, they come with consequences. And one consequence of legal drugs is you're sending a message that this is okay, especially with marijuana when we have people out there saying this is medicine, that this is medical. So the kids are hearing a double whammy. Not only is it legal, they're hearing that it's a natural herb supplement that they can take when it is literally the furthest thing from that. It is quite high octane, quite dangerous.
Yeah, I think there's a really interesting thing about this not being your grandparents' or your parents' marijuana. I've talked to some boomers. I've been on a real boomer hate tear on this podcast lately, but there are a lot of them who are they say, I used pot 60s and 70s. I turned out fine. I stopped when I got out of college. Can you just say more about like how different it is now?
Yeah. I mean, basically what they were doing back in the 70s and 80s was not even the same drug. I mean, it was basically like there was very little THC that was in those joints that were rolling in the Woodstock days. I mean, 1% joints, we're talking about 2%. So it's literally 50 times more potent now what's being sold. And so when someone's using it, their consumption. So there was actually a great researcher, Jonathan Calkins, fantastic researcher from Carnegie Mellon. And he said this a few years ago. He said, comparing the consumption of somebody in the 90s, like a marijuana user in the 90s, on average per month, they were consuming like 1 20-ounce Diet Cola worth of caffeine. He was giving the example of caffeine to THC, 1 20-ounce cola worth versus the average consumer today, 33 medium Starbucks cappuccinos worth. That's the increase in consumption. So it's literally 33 cappuccinos worth versus a 20-ounce cola from a couple decades ago. So not even close to the same consumption, not even close to the same kinds of products. The other thing is they were not getting products that were genetically modified and tampered with, like what we're seeing with these products today. These products today are coming out of labs. They're not coming out of just natural grow facilities. And if they are being grown, if it is coming from plants grown in the ground, it's plants that have a whole lot of pesticides, a whole lot of changes that now have way more THC than the plant ever had before.
Yeah. Yeah. I mean, sort of what I'm interested in here is what does it do to you now versus what it would have done to you like 50 years ago? Because I mean, okay, if you're having, in your example, 1 Diet Coke 50 years ago, you're having a Diet Coke, right? It's nice. If you're having 33 Starbucks cappuccinos, you are probably like in the fetal position on the floor. like what does it actually do? Like to an individual?
Yeah. Well, what we're seeing is more violence.
Yeah.
So, somebody who's going to smoke a joint back in the day, a lot less of a violence association with marijuana.
Yeah.
And now what we're seeing is actually people going psychotic, shooting people. There was a guy in a city that I grew up in for a number of years in Colorado, Aurora, that he ate a edible and a few years back and got a gun, shot his wife, shot his kid, then shot himself. You see more stuff like that happening. Obviously, it's not everybody, right? But it's a lot more cases of that happening with the use of these products than ever before. So I think the violence, the psychosis is another thing we really didn't see a lot of. Though I will say, we kind of had our early warnings that this was going to happen. So a lot of people would be shocked to realize they think that, marijuana is a racist term, that we banned marijuana because we're a racist country. Well, newsflash, not at all the case. Mexico actually banned marijuana before the United States did. And when Mexico did it, it was in response to a huge increase in cases of psychosis, mental illness, violence, things that were happening in their society that they tied directly to the marijuana of those days. This is way back in the mid 1900s. So clearly we had our warnings about what the potential was of this plant, but it has gotten infinitely worse now.
Yeah. Well, and there's a certain piece of this in which I suppose marijuana is legal in how many states?
It's about 24 states that have it recreationally legal, and then there's about 30 states that have some sort of medical. Some of them much more limited.
Okay, so let's assume you're getting it in one of these states where it's not legal to get it recreationally. There is a drug trade problem that contributes to the violence as well, right?
That's correct. And actually, it's not just in the non-legal states. It's actually worse in the legal states, believe it or not.
Why is that?
Because what's happened is there was this promise, and this was the second big promise made to us in Colorado, which is that we were going to legalize marijuana. It was going to get rid of the black market. Yeah. Well, we actually brought in more cartels than ever before. And I'll give you a few great examples of what happens. So basically, when a state legalizes marijuana, they give cover to, you're now allowed to grow and distribute marijuana. That's now state legal. So it is very difficult for law enforcement, first of all, to have enough funding to inspect everybody who's growing and selling and producing marijuana. Second of all, you have these massive grow facilities all over states now. And it's hard to tell what's cartel run, what's legal, what's not. And so what we've seen is massive cartel activity in states. So Maine, for example, has seen giant Chinese cartels come into Maine and basically take advantage of their program. So what happened is Maine is actually issuing licenses for state medical marijuana grow facilities to entities that they know are fronts for Chinese cartels. They know it. But because of the way the statutes are written in Maine, they can't deny them. So they continue to grant them licenses. The Chinese cartels now are using these fronts to grow marijuana and sell it illicitly. And not only marijuana, they're also using this to launder fentanyl money into the American financial system through the cover of state legal marijuana operators. It is absolutely stunning. And the other thing is, and I know you might want to comment on this, but the other thing I'll just say is it's not just fentanyl and other drugs getting involved. It's human trafficking that's involved with this. Yeah. There was a big analysis done by NBC that found most of the marijuana that's consumed out of the state legal markets has touched human trafficking victims in some way, which is just appalling.
Yeah. Is there any way, and I'm assuming the answer is no, to do this certification process well? Like, is there any state that's doing it that's...
No. I mean, you look at every single state, it's rife with corruption. I mean, you look at Colorado, for example, the guy that's in charge of regulating the marijuana industry, he is in the marijuana industry. He had to sell a giant chain of pot shops just to be able to take that job. So it's literally hiring the fox to guard the hen house. You don't have parents on these regulatory boards. You don't have doctors. You don't have anybody that's concerned about public health. So we see a lot of corruption. We see people taking literal retainers from the industry while in their jobs. Like the Secretary of State in Oregon was literally on retainer by one of the marijuana companies that she was responsible with regulating in Oregon. She literally had a retainer and a contract agreement with them, making tens of thousands of dollars. So unfortunately, we have not seen this go well. And I think, quite frankly, the reason why is because when you get into the business of drug dealing, it brings around a lot of bad things, Nick. I know this might be kind of surprising. You get more crime when there's drug dealers around. You get more life gets worse when there's drug dealers in your neighborhood. This is state-sanctioned drug dealing. Yeah. And we need to be real about it.
Yeah. I think there's a certain part of this too in which it's a lot of people are thinking a lot about what they want in their neighborhood. Yeah. Right. They don't want people smoking pot on the corner. They don't want the vape and hemp store to move in across the street and all the seedy characters who frequent it. Is that okay? Is it okay to want that?
I think it's sort of normal. We're both dads and have wives and children. And I think, we want our kids to grow up in an environment where they're enabled to succeed. And I think, when we think about building society in a way that we want to build it, in a way that our kids thrive, in a way that our economy does well, in a way that people have good jobs, all of those things that we want for our society, drugs are antithetical to the entire idea of building a stronger America. They just are. You can't have a strong America that is hooked on drugs. You just can't. And so we need to build our policies backwards from that very obvious proposition that I think 90% of Americans would agree with, is we don't want folks to be addicted to these substances. We don't want folks to be using them because of how it hurts and deters the things that we want. So we need to have policies that encourage people to live their best lives, that keep them free from being victimized by the industry. And one of the key ways you're victimized is when they're putting 5 pot shops on one block in some of the poor neighborhoods around this country. I have a real problem with that. And I think that we've seen enough of this playbook from these other industries that are out there. We need to put a stop to it.
Yeah, I get the feeling that people are starting to treat these like hemp and vape shops or whatever you want to call them, the way that they would strip clubs. Like, I don't want to live near that.
Right.
Right. But what are you seeing? You said something earlier about increasingly young people are starting to turn against this stuff. What are you seeing in the polling about that?
Yeah, good question. So we're doing some polling, and what's interesting is looking at nationally, we did some polling, and interestingly, we're now at a place where, according to Gallup, that most Americans now think that marijuana has a negative impact on society. That was just the most recent polling that they did. Negative impact. Then you look at the state level. We saw some polling in Maryland, where Maryland 60-40 voted for legalization back in 2022. Now, most Maryland voters think that it was a bad decision, think that it did not make the state better off. So I think we're seeing
Imagine driving through Baltimore and thinking that.
Yeah, thinking this is what Baltimore needs is more weed. Yeah, definitely not.
Yeah, this was a bad idea.
Yeah, and interestingly, you look at the crosstabs of some of these polls, and it's the minority communities that actually overwhelmingly think it's been really bad. They've seen the impact. They've seen the harms on their communities. They don't want it in their communities. We're actually, Detroit is a place where obviously there's loads of pot shops that are targeting the residents there. They're pushing back saying, why are we getting this stuff in the mail? Why are we getting ads in the mail? Why are we seeing these near to our schools?
Yeah.
Why is the industry getting around some of the regulations just because it's in Detroit? So we've actually been working in that city trying to push the industry back there as well. So I think people are waking up across the country, even across party lines. This isn't working out so well.
Yeah. I had dinner 2 weeks ago with a longtime friend of American Moment, and also the second person that we ever pitched on the idea of this organization, who is the former Attorney General of the United States, Jeff Sessions, who is really a huge leader on this issue of marijuana legalization. I'm wondering if you can talk a little bit about some of his views on that, as well as maybe some other people, either prior to President Trump in 2016 or since, who have been really good on this issue.
Great question. Yep. And Jeff Sessions obviously was a huge hero of the anti-drug movement and really carried held the line for a long time. And he was fantastic as Attorney General. He most notably withdrew the Cole memo that the Obama administration had put in place that said there was going to be non-enforcement of marijuana laws other than a few key priorities. He withdrew that. That has not been replaced. So the federal government policy is that it's all illegal and it could be enforced at any time, which I think is fantastic. And that's something, by the way, that I think is important to have on the record about the industry, because folks need to understand, the moment that the administration decides they want to prioritize dealing more with marijuana, they have full reign, full power to deal with this industry. And so that we want to keep investors away. We want it to keep them from doing all the different kinds of things the industry wants to do.
Yeah. So even though it's been legalized recreationally in a lot of these states, it's technically still illegal on a federal level?
Totally federally illegal.
How does that work on the ground?
Yeah, I mean, well, the way that it works on the ground is you have states that say, we're going to allow this, and the states can do that. But it is, if their law comes in conflict with federal law, then federal law supersedes in that case. And so the biggest issue is at the state level, they're able to do this. They're able to sell, do whatever they want. But they're not able to ship the marijuana legally into other states because that's interstate commerce. Mm-hmm. The other thing is they're not allowed to bank or take on giant institutional investment. And so that is the line we're really trying to hold, because obviously if the industry gets access to banks and investment and things like that, they will get way bigger. And they're already a $40 billion illegal industry, right? So your earlier question was about kind of who are the other champions. Jeff, obviously fantastic on these issues. Senator Marco Rubio is another person who's been fantastic on marijuana. Rick Scott, another great one for a long time. He has personal family connection to addiction. And he's talked a lot about that. Obviously, Tom Cotton is a huge hero. These are guys in the Senate. Pete Sessions in the House. Pete Sessions, when he was chairman of the Rules Committee, he was the green wall.
Yeah.
And so
it's
he's a
big
hero.
day for guys with the last name Sessions.
It is. If you've got Session in your name, there's like a more than 50% chance you're probably good on marijuana is my perspective of this now. But Pete has been an amazing fighter on marijuana for a really long time. And he continues to be a great ally to our organization.
Do you think that the libertarian push for legalized marijuana has mostly abated since they don't really seem to have much purchase in this administration, or would you go in another direction?
I think it's petered out for sure, because I think, and look, I love the idea of individual accountability and responsibility. Who doesn't? But we have to be realistic about society. And particularly when it comes to drugs, there's no way to isolate the impact of drugs on one person. There just isn't. If you're a parent and you're using drugs, it impacts your kids. It impacts your spouse. If you are working and you're using drugs, it impacts your coworkers. It impacts the people you're driving on the way to work with. There's no way to isolate these issues. And so I think by and large, society has said, look, we like individual responsibility, but when it comes to drugs, there's no way to make that a libertarian experience. There's no way to narrow it to one person. There just isn't. And so we have to have a more sensible policy where we are discouraging this. The other thing is, looking at this from a business perspective again, we have the most advanced economy in the world, in the history of the world. If you're going to start a company in this country, it's the easiest than anywhere else in the world. You have the best chance of success. That's amazing. We have the best innovation in this country. All these things are incredible. But our preceding generation made a very good decision in excluding drugs from our free market system.
Yeah.
Because when you put drugs into the free market system, what is it going to do? It's going to find a way to deliver them cheaply, more pleasurably, make it so it is enjoyable the whole time, or where you want to use it over and over and over again. In other words, addiction.
Yeah.
And that is just the profit incentive. So we cannot allow that into our system. We just can't.
Yeah. No, I think that's absolutely right. I mean, not we, but I guess nations have fought wars over it. Like the opium wars are, a pretty good example of that.
And in many ways, we're almost in an opium wars too right now.
Yeah.
But it's China trying to pay us back at this point.
Yeah.
You look at what China's doing. They're shipping fentanyl over, the analogs, everything else the Trump administration is trying to stem the tide of. But people aren't talking about the fact that CBP is picking up thousands of pounds of marijuana over the border every single day. I mean, you watch their Twitter feed. Marijuana is always in that discussion. And now the enemy is truly within when it comes to marijuana, because they're producing marijuana within our borders now under state legal sanction, and they're distributing marijuana that way as well. And it's the cartels who are profiting from this, a lot of them backed by China. And now there's increasing reporting that it's also connected to the CCP. So if you don't think that this is a foreign threat, that this is actually a national security issue in addition to a domestic issue, then you need to read up on the news, because quite frankly, the way China is getting this again, it is like an opium wars again, except it's with marijuana now.
Yeah. You made a really good point earlier about how a lot of these marijuana companies took advantage of veterans to push legalization. Can you say more about that and why it doesn't work?
Yeah, it really bothers me because, nobody's a stronger lover, supporter of veterans than myself. I have family members who are in service. I have friends and neighbors who are in service. It's something that I really strongly believe in. And I hate to see when people who are vulnerable are used to line somebody's pockets, okay? And when it comes to marijuana, it's really irritating to me, because what we are seeing is people out there saying this literally cures PTSD. And they find a few veterans who are willing to say that. And, I don't know what's true and what's not. Everyone's entitled to their own personal experience. But when we are voting on policies that impact all veterans, when we're saying all veterans are going to have access to this, and this is going to be something that's pushed to all veterans and to everybody in a state, now it's available, that is deeply concerning to me, because it has far-reaching implications for them. And so there was a major literature review that was done of 500 different studies that looked at marijuana's impact with PTSD. And what that lit review found, looking at 500 different research studies, was that marijuana makes PTSD worse, not better, makes them more prone to anxiety, now is more linked with suicidal ideation, is actually causing a host of new problems for our veterans. Of course, this came out a couple of years ago, 10 years after states started legalizing marijuana, 20 years after states started legalizing medical marijuana. I mean, now we learn, oh yeah, by the way, it actually doesn't cure PTSD.
Actually, it makes it worse.
Yeah. And so who won with that? Not veterans. Veterans were used in order for these companies to get legalized and make billions of dollars in profit. I have a problem with using our veterans for that. And unfortunately, we're now seeing the same playbook happening with psychedelics, where we have now these same companies, same investors, they're all profit players that are saying, oh, psilocybin now, that cures PTSD. It's like, well, you made us all pass ballot measures at the ballot in a lot of different states saying marijuana would cure PTSD. So did marijuana not work out? Is that why we need another drug now to cure PTSD? But nobody wants to have that conversation. Everyone's like, oh yeah. Like that's old news. Now we need this.
Yeah, it's like Lucy in the football.
For sure.
For sure. Pulling it out of the way.
For sure.
Before we get to the psychedelic stuff, I also don't think a lot of people understand that, like, when you get a medical prescription for marijuana, it's not like you're getting like a bottle of pills. Like, they're literally just giving you a prescription to smoke marijuana.
Not even a prescription.
Say more about that.
You get a card that's called a marijuana recommendation, and your doctor can recommend it for you. And they give you a card.
Take it to your bookie on the corner,
to the dispensary, and you can buy whatever you want from the dispensary. Yeah. No dosage, no refills, no contraindications. If it bothers you with any of the other medications you're taking, you have no idea. No, hey, take a few puffs of a joint. Nothing. No guidance at all. And it's crazy because what these programs look like is most of them you can get a card within 30 seconds. Literally, you click, and you got it in most of these states. Second thing that's interesting and most people don't know, and they should know, is that it's a total racket on the distribution side. So doctors, there's 17 doctors in Pennsylvania that have made up for more than 100,000 of the medical marijuana recommendations. I mean, these guys they're not even assessing these patients. Like, it's just in the door, out the door. And one doctor was discovered in Pennsylvania, co-located his clinic with a marijuana facility. So it was just like one-stop shop. You go there, then you go to the next door.
How long did it take him to find that out?
Oh, so it is a total farce, and I think people know that. And I think what we've seen is also, the prototypical person getting a medical marijuana card, by the way, not a cancer patient. Everyone has this in their mind. They think it's the people getting this are people who just desperately need it, somebody with severe disorders. No, it's typically a 30-year-old white male who's saying it's for generalized pain.
Yeah.
Those are the people who are getting the medical marijuana card. So this isn't something that's treating people with cancer. That's not predominantly who they're looking at when it comes to this.
Yeah. I actually don't know the answer to the question that I'm about to ask, but I'm sure the answer is they're finding some way to do this. Is the health insurance industry profiting off of this at all?
So no, they're not. Right now, anyway.
They'll find a way.
They'll find a way. They'll certainly find a way. I will say, they're going to be they have a lot more to deal with now on cannabis use disorder treatment, like treatment for marijuana addiction. So that's going to be an area that'll probably grow.
So they usually don't cover it, like if you get a prescription or that kind of thing.
So, they don't cover you can't get a prescription for marijuana. That's why they can't cover it.
Right.
But the moment and now some states are trying to force that to be able to happen. And maybe that's on behalf of the insurers. I don't know. But there are states that are trying to say Medicaid needs to pay for medical marijuana.
Oh my gosh.
Yeah, they're trying to make Medicaid pay for it. And that's another thing, by the way, the whole libertarian thing, that's the other thing, reason why that doesn't apply here, because, 100 plus million Americans are on Medicaid or Medicare. That's taxpayer subsidized insurance. And so if you're going to bring marijuana into this kind of pseudo medical space, which is not really, then we're talking about taxpayers paying for it at some point, which is crazy. We should not be paying for marijuana.
Yeah. Is there anybody out there making like a left-wing case against marijuana?
Oh yeah, absolutely. So
really?
So we're a nonpartisan organization. And actually our other co-founder is Patrick Kennedy, the former Democratic congressman from Rhode Island.
So how does he sell this?
Yeah, so he is in recovery himself. And so for him, it's all about recovery. It's all about, so his two signature things are one, his recovery and trying to help get more people comfortable with talking about being an addiction, talking about getting into recovery. The other piece of it for him is mental illness and his work on mental health and making sure people get treatment for that. So those are the two things that matter to him. And what he goes around and tells people is, look, the big tobacco, people on the left, they're very worried about big tobacco. They've seen the impacts. They don't like that they're involved. And then the other piece of this is, this is more addiction for profit stuff that's going to ruin people in recovery. And Patrick is one of them. And he says people in recovery need to have environments where there's not free access to the drugs. That they are not being hit with advertising all the time. And that applies, everything else we talked about, sports betting, porn, all those different things, I think fit in that rubric. And interestingly, I will say, you look at like Ezra Klein, for example, and I'm not a huge subscriber to all the stuff he's talking about, but I will say he's having some very thoughtful discussions around, is this really the society that the left wants too? I mean, where you have people who are addicted to all these different kinds of vice. And I think he's trying to open the door for the left to have those conversations too. And he's been a little critical of marijuana as well. So I think we're seeing folks on the left really start to pick this up in their own way.
Are there any Democrats in Congress who would like, if it came up for a vote for some reason that we were going to get more strict about this, that would vote for it?
Yeah. Oh, there are for sure Democrats in Congress
really?
On the House and the Senate side. So on the Senate side, Hassan, Shaheen, they've been vocally against legalization of marijuana, totally, kind of bucking the Democratic narrative. A few other senators and Democratic senators who have also taken that approach. In the House, there's a number of members too who I think have a lot of concerns. Like, you look at Madeline Dean from PA. She's a very sensible Democrat. Her son is in recovery. She sees these issues in that lens, and she knows that more addiction is not good for society. So there are folks, and look, we're not going to agree on every single thing, but I think what's important is that you have an understanding that, more marijuana is bad. More addiction is bad. If we can agree on those things, then I think we can find areas to agree in terms of policy.
Totally. I would stand by, elected Democrats on that issue.
Absolutely.
100%. Are there any states where it's gotten so bad that they're actually considering a referendum to overturn the previous referendum?
Yes, absolutely. There are. And so that's, the last 4 years have been really a sea change for us. Our organization has skyrocketed. I mean, much the way, maybe not quite as big as you guys have gotten. You guys are killing it. American Moment is the spot, and you aren't paying me anything, so I can say whatever I want. You all are the game in town, and everybody knows it. So Nick, you're doing a great job in leadership now. But what I would say is we're definitely finding our moment too. We're having our American moment, if you will. Yeah. And the last 4 years, we've seen a lot of wins. Basically, every state other than 2 deep blue states has rejected the legalization of marijuana at the ballot over the last 2 cycles. It's been fantastic to see that. Florida was a big win for us.
Yeah.
Florida, the marijuana industry put in the most amount of money into a ballot measure in the history of this country.
That was last year, right? Because I remember we did an election night party here, and the results for that started coming in the earliest. And I remember there were a bunch of hoots and hollers at our election night party when that failed.
Yes, we were thrilled.
I remember that.
We were up against $150 million.
Wow.
And we raised, I think it was 12 or 15 million total. And we beat them.
Common sense won the day.
Common sense won the day. David and Goliath fight, which is absolutely what it is. And so, so we've seen a lot of growth. Now what we're seeing is there are more people with money now want to give to trying to roll this back. And so what we're seeing now is there are going to be 2 states likely that'll vote on repeals on the ballot this next cycle. So it's public now, so I can talk about Massachusetts. They are going to be qualifying. It's a blue state, but there's a lot of people that are saying this is enough for whatever reason. There's a lot of corruption. They were promised social equity. That didn't happen. Go figure.
Yeah.
A lot of other issues there. There's another state, and I can't say the name of that state, but stay tuned. There will be 2 states that are going to be voting on us. It'll be very interesting.
That's very cool. So are we going to reschedule marijuana? Is this going to be a
good question?
A thing?
Good question. That is the question, the topic du jour.
Yeah.
So obviously we are the leading kind of folks fighting against rescheduling marijuana. In a nutshell, what's going on right now is Biden recommended a couple years ago, he said, let's reschedule marijuana down from Schedule 1 to Schedule 3. And what that would mean is it would stay illegal, but it would send a message to the public that marijuana is less harmful. It would also give the industry a giant tax break. It would let them write off all of their business expenses. So advertising is really the key one there. Yeah. Nobody wants to see the marijuana industry able to advertise more than they are right now.
Yeah.
But they would actually be doing it a lot more because they stand to make $2 billion off of that in terms of tax write-offs. So those are the 2 things at play with rescheduling. Biden recommended it. It got stalled. Trump took over. Now Trump's administration is taking a look at it. About a month ago, Trump said, we're looking at that decision. We'll have a decision soon. And we are waiting to see what that decision is going to be.
Yeah.
And so we don't know which way that's going to go. But obviously, we've been doing a lot of work with as many people as we can to try to oppose it.
Yeah. What would be sort of maybe it's just the tax breaks thing, but what would be the worst consequence if it were rescheduled?
I think definitely the tax breaks, because you're going to just see a lot more. But then I think probably secondarily to that is this, a lot of states have trigger laws. So there's about, at least a dozen states in the country that their scheduling of drugs at their state level is tied directly to the federal schedule. So if marijuana goes down in schedule, these states then have to promulgate new regulations and rules around marijuana.
Yeah.
So it would create a lot of havoc at the state level.
Right.
And that's something that we've been kind of working with policymakers to deal with.
I don't think anybody thinks that the president actually likes pot.
No, he does not. Nope, he doesn't.
Right?
He doesn't.
Like the man just drinks Diet Coke.
Yes.
You know, he doesn't drink alcohol. He doesn't smoke pot or do any of that.
Yeah.
What kinds of, you don't have to name any names, but what kinds of people do you think are going to try to influence this decision?
Yeah, I mean, this is really the people who have an incentive to influence this are the industry. And so the biggest player by far has been Trulieve. Trulieve, I think, is America's biggest marijuana company. If not, it's one of them. Multi-billion-dollar marijuana company. They're based in Florida, totally federally illegal. I mean, these people should be prosecuted, quite frankly. But their CEO is Kim Rivers. And she has a lot of ties into the Florida GOP. I think she has a relationship with some people very close to Trump. So she's been using that. They have been the face of this push for rescheduling. And by the way, Trulieve is also the face of that ballot measure to try to legalize marijuana in Florida. Yeah. So we beat them in Florida. We're hoping to beat them federally, but they're the ones to watch. They're the people that are really pushing this.
Very interesting. Last question before we get to the psychedelic stuff, which I'm actually very excited to talk about. One of the biggest, pushbacks that we get on the being anti-pot stuff is, well, your position would just put a lot more people in jail, in prison, et cetera, for possession, for dealing, for trafficking, whatever. I don't know that I really actually have like a set position on what the penalties should be, but maybe you guys do.
Yeah.
I don't know.
So we don't think that people need to go to jail for having a joint in their pocket. So when it comes to simple possession, if you're talking about small amounts, we don't think that you need to get criminal penalties for that. Yeah. And really, you look at the federal numbers, nobody's going to jail for possession. It's all about the trafficking and the distribution and all of that. And so those are the things that need to be illegal and keeping an industry from coming into power. So I think that is where you want to focus the criminal penalties. And I think, frankly, I think folks are crazy if they don't see why we would want to do that. Those people should be in jail because
they're usually doing a bunch of other crimes.
It's the cartel members who are the ones doing it. It's, we're seeing all this data right now. The people who are killing folks out there, the crime is so much of the crime we're seeing is tied to drug dealing and a lot of times tied to marijuana. You look at all of the last really most of the mass shootings over the past couple of years had direct ties to marijuana use. I mean, the Minnesota shooter worked at a marijuana dispensary. Really? One of the top marijuana companies in the country.
I did not know that.
Yeah, Green Thumb Industries.
Wow.
Worked at, and if you go back and watch the footage again, which I guess we don't really want to do that, but you look at the footage, the shooter was wearing the dispensary t-shirt, the marijuana dispensary t-shirt.
Wow.
And it was a medical marijuana dispensary.
Talk about bad PR, man.
Yeah, absolutely bad PR. And it was right around the time when we were hearing all the rumors about rescheduling. It's like, here's a great example of why marijuana has such dangerous side to it. People think it's no big deal. Why should anybody go to jail?
It literally drove that guy crazy.
Yes. Yeah. And the shooter actually attributed in the journal said, weed and gender effed my brain up and led to everything that's going on. So, I don't know to what extent what is the most powerful, right? Was it gender? Was it marijuana? But I know it was a factor to play there. And we need to have a conversation about that. Yeah. We definitely do.
Yeah. So there has been, moving to the psychedelic stuff, there has kind of been this big push that you were alluding to earlier. Actually, pot isn't enough. Now we need psychedelics. And I think a really good example of this is, I was telling you before we started recording about this podcast that I listened to about a year ago, and it was Danica Patrick, the NASCAR driver, on Tucker Carlson's show, which I'm listening to every episode. I'm a huge fan of. This is not a dig at Tucker by any means, but listening to that, I did it while I was like mowing the lawn, and so I was like really locked into what she was saying. And she sounds crazy, like talking about how ayahuasca or whatever like saved her life. And it seems like it kind of started off as like a hippie thing. Like it was only like weird people going and doing these like ayahuasca retreats in Mexico or whatever. But first of all, like what are the psychedelics? Like I'm so not cool anymore that I like don't know anything about these. But also like, what do they do to you? It seems like if weed's bad, this is a lot worse.
For sure. I think these are like nuclear bombs to your brain, quite frankly. And that's why I think it has such significant stakes. Truly they are. And actually you talk to advocates for psychedelics and some of them will even agree with you. They'll agree with me that it is like a nuke to the brain. I mean, we're talking about serious stuff to rewiring your brain's pathways. So what we hear the most about right now, psilocybin, magic mushrooms, that's kind of the one that's getting some play at the state level, different referendums. Then the next one that we're hearing a lot about is ibogaine. And ibogaine is another substance that
I've literally never heard of that.
Yeah, it's crazy. So ibogaine, I won't even go down the weeds with all these, but psilocybin, ibogaine, and then ayahuasca are the three big ones. But then there's a lot of others. There's DMT, which is like toad venom, a whole lot of other substances. I know it's nuts. And you watch these documentaries and videos that are being done, and it's like you're like, this is crazy town, right? Yeah. So those are kind of the big substances of the day that are being talked about, and all of them dramatically alter your reality for a very long period of time. You're talking about several hours of tripping and make you very, very exposed. And what they leave you with is we just don't know. We know that it has a very significant impact on your brain. There's some research that says this may be promising for certain things like addiction or PTSD or other things. Maybe that'll work out to be the case. Maybe, I don't know. But what we do know is what's happening right now is people use it, and most of them have very bad experiences with these drugs. The trips leave them very negatively impacted. We know that the research is being done predominantly by people who are currently using the drugs. Nick. The people conducting the research are current users of the psychedelic drugs. That's what we're finding in the research. So they're totally not unbiased trials. They're very biased. People trying to cook the books. The other thing we're learning is that what's happening in these trials is there was a recent study done with psilocybin where there was accusations of sexual misconduct because somebody's tripping, they don't know what's going on, they can be taken advantage of. That's happening during these research trials. Also, the folks that are being so the folks administrating it are users. Most of the people that they're admitting to these trials to actually take the substances for the testing are people who also currently use the substances as well. So the research is totally bogus. I mean, it's totally suspect. We don't know what is possible with these drugs, but what we're getting right now is very lousy data. And so the claims that are out there that are saying this cures PTSD, solves addiction, solves all these problems, totally wild claims. We saw Colorado and Oregon. These are the only two states that have legalized them for medical use. Ever heard of medical psychedelics, medical marijuana? No. Same game plan. And so that's what we've seen. But the research is very suspect at this point.
Yeah. I mean, the way that you hear this sold, like in op-eds or people telling stories on podcasts or whatever, is like, oh yeah, I went to Mexico and I like did this retreat and, I came back and I was like totally fixed. But you never hear stories about like people going back to like normal life. Like they just keep going back and doing these retreats. If it's actually supposed to fix you, like, why does it not just fix you?
Right. Well, and that's the funny thing you said, because with ibogaine, they're out there, their slogan is like one and done. Like they say, like it's one and done. It's never one and done. No, you're not fully fixed. But I will say it leaves a lasting impact on your brain. Like people are not the same after they use. And not only that, there's this issue that we're starting to learn about now that's kind of poking its head called hallucinogenic persistent disorder. So HPPD. And basically what that means is people who use these psychedelic substances, psilocybin, ayahuasca, ibogaine, whatever it is, they will have hallucinations and actually feel like they're tripping again randomly months, years later after using it, even if they haven't used it. Which that is very frightening because you think about, okay, if millions of people start using this and somebody's a bus driver, airplane pilot, and then they have this happen to them, all of a sudden they'll crash it.
Seems bad.
Not a hypothetical, Nick. Do you remember the Alaska Airlines pilot who crashed his plane when he off psilocybin?
He stole
magic shrooms. Tried to steal it, and he tried to crash the plane, and it didn't work out. They were able to stop him. So he just he's doing time now. He just pled guilty. That was HPD. He didn't use it the night before. He used it like a month prior, and all of a sudden started having hallucinogenic effects. And so these are the consequences of just shotgunning these drugs onto people without even having any kind of understanding of what they're going to do to people. So those are the stakes. Those are the stakes is you have a pilot who didn't use for like a month, all of a sudden having a hallucinogenic episode. And
now he's destroyed his life.
Yeah.
I think I saw something where they were going to put him in prison for
sure.
It was like 30 years or 40 years.
Like 100 counts of attempted murder.
Oh my gosh. That is unreal. Well, the really interesting thing about it is, again, you see all these people talking about it like it's like a one-shot drug and it'll fix you, but none of these people, they just don't seem normal. And maybe this isn't your lane either. Like maybe this isn't the way that you would describe it, but it all seems so demonic
For sure it
to
is.
me.
Yeah.
Like usually when you read accounts of people having done this sort of thing, it's like, I saw my worst nightmares, come to life.
Or they saw demons, literally, or they saw literally Satan. People will say that.
Yeah.
And that's not, I mean, I think that is true. I think, and that's part of what makes me really care about this is I do think there's a spiritual component to this.
100%.
I have friends who, they've been in addiction. Thank God I've been substance free in my life. I haven't gotten into addiction, but I have friends who have told me that, they don't even believe in God, but when they went through addiction and they experienced what they experienced where they saw stuff, they said they knew that there was something spiritual there. Yeah. And so I think it's real. And also, you look biblically and there's a lot of discussion around, like in the Bible, there's this term pharmakia. And that term, a lot of people, it was referring to rebellion. And the Bible says rebellion is like the sin of witchcraft. And I think a lot of people think that there's a tie with that word and its connotation and its context at the time, where actually some of the witchcraft that was happening in the Bible times was actually related to drug use.
Yeah.
And so there's a lot of discussion around that.
Well, there's a reason why, like, the Aztecs were doing all this stuff and then sacrificing their children. It's not normal.
Never seems like a good idea when you're sober-minded, does it?
Right.
But if you're tripping out, there's a lot of crazy stuff you'll do. And I think that is something we should be sober-minded about, quite frankly.
Yeah. No, that's a really good word. Well, I think we have a lot of friends listening to this podcast who are, currently serving in the administration and have the ability to do something about this. So if they want to find out more about you and the important work that you're doing at SAM, where should they go?
Absolutely. So on X, you can go to Luke Niforatos, just Luke NIF, and you'll find it. I'm the only Luke Nif there on X. Check out our website, learnaboutsam.org. That's got all of our stuff about marijuana, everything you can learn. And then now we've expanded. We cover all drug policy. So psychedelics, opioids, fentanyl, all that stuff, guidance on all those things. That's at gooddrugpolicy.org. So those are our two websites. Check it out. We have science advisors. We have research. We have all the different things that we're doing. And we're involved in pretty much all the states too.
Yeah.
So.
And I should say this is a pretty big endorsement on our part, but you and Jordan on your team, we've had you guys coming in and giving lectures to all the people going through our programming for years. We love the work that you guys do, and so are super glad to have you teaching the youth, as it were.
Thank you. No, I think we're honored by the partnership, and I'll just share a word with you, Nick, about, one of the things I know that's near and dear to your heart when it comes to what this organization does is going out and bringing people from states where, in the past they've been overlooked by the elites. And I think that core to your thesis is bringing people who have actually really great ideas and really strong talent, giving them a chance to come to DC, giving them a stipend, giving them a chance to actually thrive out here. There's really nobody else that's tackling that problem that cares about those people. And so I think it just speaks highly about you as a person, your leadership, and what this organization is going to do, what it's already done, and where it's going. So I just hats off to everything that you're doing.
I appreciate that, man. Well, thank you so much for coming back on A Moment of Truth.
Thank you for having me. Appreciate it, brother.
Thank you for tuning in to another fantastic episode of Moment of Truth. And thanks to Luke for making the time to come down to our studio to record this podcast. Once again, you can find out more about his organization at learnaboutsam.org. And he's on X, and I think it's just Luke Niforatos. Pretty easy to find. Puts a lot of good data and information and news out there about what's going on in the marijuana movement. So make sure that you go and check that out. Thank you for tuning in this week, and we will see you again next week. Moment of Truth is an American Moment podcast taped at the Conservative Partnership Campus Studios and is produced by Jake Mercier and Hunter Smith, with original graphics and title cards by Jared Cummings. Our intro song is A Minor Struggle by Ryan Serenich, and our website is AmericanMoment.org.